ko mahu ki te rangi tōku waka, ko maunga keke, tōku maunga ko Waitamata, tōku moana, ko Orake, tōku marae ko Ngāti Whātua, tōku iwi, ko Paurere Oti, tōku whānau, ko Mihi Blair ahau. Kia ora, Mihi Blair, I'm the National Tobacco Control Advocacy Manager for Hāpai te Hauora. Our team is made up of two amazing women, Lizzie Strickett, who's our researcher and comms person, and Felicia Monsieur, who is our project manager. And we also have contractors involved, and that's Edward Cowley, who runs our Pacifica coordination coordinator. So we've got a small team, but we provide leadership tobacco control all over New Zealand. So we capture all the kōrero that happens in the smoking cessation services, any issues, but you're also celebrating some wins in our smoking cessation services across the country. Well, we've got a couple of goals that we want to reach, and that's reducing supply of tobacco within our communities. So a lot of our targeted population groups, which are Māori and Pacifica mainly, they have a high amount of tobacco within their community. So we about 4 times higher than the average community like Remoera or some of the rural areas. So we really want to reduce supply around those communities, especially around our kohanga, so that's one of our goals. The other goal is reducing harm, so and that's providing quality, advocating for quality services for our targeted population groups, and providing successful quit tools such as vaping, so for those who want to quit. So one of those two goals combined will help also with the overall goal of reducing inequities within our people. So we're really focused on those two for the next financial year. Yes, so we have undertaken quite a bit of research since I've been in the role, and one of the main ones that Lizzie works well with Otago University on the vaping projects that she has at the moment, and those sorts of ones will tell us how beneficial vaping is for our Māori women, which is really a key for us to reduce harm. So that's one of the biggest projects Lizzie's been on, but also we have worked with Auckland Council. We've been contracted with them alongside with Nihi, the University of Auckland team, to provide a program guide around providing good services to our communities. We've taken a targeted approach. So we've been involved in those projects, but we've also supported small projects like the Ministry of Health tobacco tax report. So we help co-facilitate with EY on that. So just to ensure that our community voice is being heard effectively through all the channels that it's required. Yes, so in particular our wahine Māori and Pacifica, the rates haven't actually moved in terms of reducing smoking. So that's been our biggest concern and our focus, and really our focus is actually required on pregnant women, our wahine hapu, that are smoking while pregnant, but don't have the particular services around them that can support them. So we sit on advisory boards. Hāpai also holds the SUDI contract, the national contract for that as well. So then we can ensure that we advocate for good services for our wahine, and also our children need to ensure that there's a good education piece for our rangatahi, that there is that they know that smoking tobacco is harmful, and also that vaping's not a pathway either for our people. So we are really trying to put pieces together and working with other groups to make sure those messages are going to be developed over time and effective in reaching our people. We work with Cessation on the high level leadership spaces of like DHBs and with ministries. So there are services like Quitline that anyone can utilise, and they will refer on to local services within people's areas, but also the midwives play a key part in reaching our people and educating our people. But we've got to take a step back, because a lot of our whānau aren't actually going to the midwives until later in their pregnancy, and so we need to engage with them a lot earlier. So that's been one of the key areas that we are working that we advocate for, is making sure that services are more accessible for our people. So that's one of the big things we're doing. Yeah, so if people want to talk about what's happening in the advocacy world for our Māori whānau or Pacific whānau and tobacco control, or any service that Hāpai run, it's best to go on our website and have a look at what services we do, but also remember that we are there to raise the voice for our people. So a lot of our group work that we are doing is actually matches with research, and so it's really a good combination of true leadership for an organisation like ours. So once we have the ability to raise our community voice to the higher levels, then we actually can get some really good results. So that's what we're hoping for. With the Smoke-free 2025 goal that was set 11 years ago, I think that is the biggest goal that we need to achieve, and especially for our Māori women, being role models for our tamariki. I think that's one thing that we need to actually embrace, and actually look at that as a positive, that we actually want to have our Māori people being smoke-free by 2025. But what we need to do is advocate for better services for our people, maybe for Māori by Māori, or best services that are actually on the ground, and community mobilisation pieces actually need to happen. But for our role, we need to advocate for effective reinvestment of our government money to go into those services to be effective. So yeah.